come from? That cobbler lost everything for the customers if he had a family or if he has a family back home. Yes, well, they're going to be getting food in that regard. Government needs to step in right now and alleviate the suffering of those individuals. They shouldn't be congregating in despair like that. COVID-19 is spreading like that, and it will lead to more cases being registered right here in Uganda. Away from that conversation, we would like to talk about chronic diseases. They account for 16 million of the deaths we are seeing or registering every year under people aged under the age of 70 in that regard. Of course, non-communicable diseases account for 77% of all the chronic diseases, deaths all over the world in that regard. We also do know cardiovascular diseases are also a part of that problem, heart disease, stroke and so forth. You do have non-communicable diseases like diabetes, pulmonary respiratory disease and so forth. So we'd like to unpack how telemedicine is going to be helping such patients in that regard, technological advancements and so forth. I do have Simon Tumusime, a doctor from Rocket Health, ready to indulge us with the latest information surrounding this conversation. A very good morning. Thank you for joining us.
Good morning.
Indeed. What is a chronic disease?
All right, so chronic diseases are diseases that you deal with for over 1 year.
I see.
And they impact your daily activities, right? And you require medication throughout that whole period.
Indeed.
So they are longer, you deal with them longer than 1 year. And you need medication, you need to take medication throughout the whole time.
What do you mean you need to be taking medication throughout the whole time?
So with chronic diseases,
yes,
right? It's not a disease that you take medication for once and it's solved, right? So with chronic diseases, you have to keep on taking medication. For example, high blood pressure. If you have high blood pressure, you need to keep on taking medication every month to make sure that your blood pressure is controlled. So that's what we call, that's an example of a chronic disease.
So what are the most common chronic diseases and also their signs and symptoms, Simon?
All right, so with chronic diseases, we have both non-communicable diseases and communicable diseases. An example of the communicable diseases, we have HIV, TB, and so on. The majority of the chronic diseases, like you mentioned earlier, are mostly non-communicable diseases.
I see.
You've stated the statistics well. About 77% of all death are because of chronic diseases. And non-communicable diseases account for the most of that, the biggest percentage. All right? So an example of the non-communicable diseases, we have cardiovascular diseases. And by cardiovascular, I mean high blood pressure. I mean cardiac diseases, people who deal with cardiac diseases.
Heart diseases, yes.
Yeah, heart disease. We have diabetes, all right?
I see.
We have chronic respiratory diseases, and the most common one is COPD.
I see.
All right? The people who deal with asthma, that's a chronic disease because you need treatment for it, and so on. So those are the most common chronic diseases that we see people facing almost every day. Another example of chronic disease is cancer. Once you have cancer, you need treatment throughout your whole lifetime. And then we also have mental diseases, mental psychiatry disorders. Those are all part of.
How does physical inactivity play a part in all this? I've seen physical inactivity being written somewhere. When it comes to non-communicable diseases, physical inactivity, and it's leading to all these chronic conditions. How does it play a role?
All right, so with physical, we have what we call modifiable risk factors and non-modifiable risk factors. The problem is with majority of the risk factors are because of what we call non-modifiable risk factors. So I give an example of non-modifiable risk factors. For example, you are at risk of cancer by the virtue, for example, prostate cancer by the virtue of your age. If you shoot above 40, right, you are at risk of prostate cancer. So that age is a non-modifiable risk factor. There's nothing you can do about your age. You have to hit 40. All right. We have gender. If you're female, you're at risk of breast cancer. All right. And then we have
and so forth.
All right. Then we have things like genetics. If your father had diabetes, you have a high risk of getting diabetes. All right. So those are what we call non-modifiable risk factors. Then we have modifiable risk factors. Modifiable risk factors mean things that you can You can adjust if you stop doing certain things. So physical inactivity is number one on modifiable risk factors, meaning that if you did exercises, you stand a low chance of developing non-communicable diseases like diabetes, hypertension, and so on. Other examples of non-modifiable
cancers, of course.
All right.
Indeed.
And other examples of non-modifiable risk factors are things like smoking, tobacco smoking, the diet, and those are the things that impact most of the low, middle-income countries like ours.
Indeed,
So,
but why is it that most of the affected jurisdictions are in low and middle-income countries? What makes us more susceptible to this problem?
because as low and middle income countries, we deal with a lot,
I
right?
see.
So, for example, if you are living in Uganda, chances are that you really have no time to go and exercise most of the time. You're trying to make ends meet, all right?
And COVID-19 made it worse.
Exactly. And then lifestyle modification. When it comes to food, it's very expensive to be able to eat the healthy food that you're supposed to eat. We try to advise our clients when they talk to us, but oftentimes, even when you're trying to advise, let's say, someone with diabetes, you know that they need a modified kind of diet, but you know it's very expensive, and this is the kind of person who comes from a very poor family. It's really going to be hard to treat them. So you find that most of us in low middle income countries are impacted highly when it comes to chronic diseases because of those non-modifiable risk factors. Right?
Simon, does that mean that we're also losing so many of our children under the age of 5? I was looking at the statistics, and we're losing more like 7.5 million young children this year alone. Yes. Under the age of 5, these children died, and some of these factors were actually put somewhere in there to show that if we actually work on these chronic conditions and so forth, we shouldn't be losing many of these young children. Premature deaths, 7 million. How does that lead to this problem you're talking about?
All right, so it still comes to the term, for the premature death, it's a combination of factors. One of them is the kind of health service delivery.
For the mother who is pregnant.
For the mother, the prenatal care, what we call before, while you're pregnant, then during birth, and then after. Usually you stand a high risk, children stand a high risk of death within those first 5 years. So they need some sort of special treatment, all right? So if you, first of all, if you don't have the money, all right, if your child is born with something that requires extra attention, let's say asthma, all right, and you're unable to meet to be able to provide for that child because they need treatment every month. Oftentimes you're busy, sometimes you forget. If your child has epilepsy and they require special attention and you don't have enough money, or you live very far off from the health center that will be able to provide that kind of help, then chances are you're going to the child stands a high risk of what? Of dying. That's one of the reasons why
you need to treat the chronic conditions as a mother who is expecting to have a child, so that we do not end up with premature deaths. That's what you're telling us.
Yes.
All right. So of course we do know that having a chronic disease is not a life sentence, of course.
Yes.
Why is it that?
All right. So the thing is, the fact is, with our health developments we've made, even in the country, it's possible to live with a chronic disease.
I see.
One of the things that you need to work around is we can try to help address the non-modifiable factors, but the most reason why people are able to live free of a burdened life is if they take medication, all right? And so that's the most, I think you could say, it's one of the reasons that determines whether you're going to live a longer life or you're going to live a shorter life. All right. So and that's one of the things that we as Rocket Health are trying to work on, to make sure that people don't forget to take their medication. They understand why they need to take their medication, and when they do, when they are busy and all those things, they're still able to keep up with their medication. So we provide something like a support system to keep you, to know that you don't walk in the journey alone. At the same time, you are able to manage your daily activities.
You see, I was looking at the statistics, Simon, and it beat my mind. This year alone, we've used 4 billion liters of water. 7.9 billion people have used only 4 billion liters of water. Then I was looking at the number of cigarettes that are smoked on a daily basis. 15 billion on a daily basis. That's how much 7.9 billion people are smoking on a daily day. What do we do to help such individuals? I was looking at some of the statistics, and exercises were being touted. If you are exercising, you have a bigger chance of beating not only such conditions that might accrue because of smoking, but other non-communicable diseases. Is that true?
Yeah, very, very true. That's an interesting statistic that you've stated there.
Indeed.
Now, one of the things that we need to do is have more of these talks. Let people know that taking more water is more important than smoking a cigarette. All right. However much it gives you that what we call short-term relief, all right? From
There's
whatever.
nothing good from nicotine, indeed.
Exactly. Alcohol consumption, excess alcohol consumption.
Killing 2.5 million people. Go ahead, Simon.
All right. So trying to have more of these talks will help try to reduce on the burden, especially for countries like ours. And then also knowing that knowing that you need to check and know whether you have a chronic disease early, so that you can easily manage your manage them early and prevent any.
And of course, this is why you're here, Simon, to talk about the amazing news coming in from Rocket Health and how telemedicine can help all these people who fall into this bracket. Talk to me about the amazing technological advancements that come with telemedicine.
So thank you for that. Telemedicine is what it essentially means, broken down. It means that all you have to do at the comfort of your home, you call and talk to the doctors, and when you talk to the doctors, they'll give you the medication. For example, let's say you have high blood pressure, all right, and you still want to go back to work, all right. All you have to do is make a call, talk to our doctors, and then they'll give you the medication you need. Sometimes we're able to even diagnose patients who don't even know that they have high blood pressure.
You don't say. I just call in and I give you a list of problems that have been aching me, and somehow, boom, you get to tell me, oh, you think you are grappling with this, but there's also another ailment. So that's how telemedicine is useful.
Exactly. That's
click of a button.
It's in a nutshell. So as Rocket Health, one of the ways that you can access Rocket Health services is all you have to do is dial *280# on your phone. There are a bunch of options that you'll see. All right. Select either doctor consultation. All right. There's an option below that talks about healthcare plans. You can select that, and then when it will prompt you to select either chronic care or anything that you're probably dealing with. So let's say, for instance, you don't know that you have high blood pressure. All right. You dial *280#, select one, talk to the doctor. The doctor answers the phone, and you tell him what has been affecting you for the past few days. All right. Let's say you've been having some symptoms for diabetes. Those include excess hunger, having to urinate a lot, taking a lot of water, and some of those symptoms. So you have such symptoms, you talk to the doctor. The doctor thinks that you probably probably have diabetes. The next step would be to order for tests. Now, this all happens while you're still at your home, all right? The doctor orders for some tests. Our team, our lab team comes to your place, takes off the samples, and all you have to do is continue doing your work and wait for the phone call from the doctor to explain the results and to tell you the next step in management. So if it turns out that unfortunately you have diabetes, then what happens is that we take over the care. If you allow us, we take over all that care, and we are able to deliver the services going forward. So every month you get your refills, all right? You get a call every month to check on your control. We sometimes offer free blood pressure checkups. You get extra information on how to prevent diabetes, and this all happens at the comfort of your home. So if you ever developed any serious complication and you don't know what you're dealing with, all you have to do, whether it's in the middle of the night, just call and you're dealing with it. So just know it's that you're dealing with a doctor.
Indeed.
You're dealing with a virtual doctor 24/7.
And of course, you simply have to dial *280 and you'll be able to actually talk to a doctor in that regard. You'll be receiving help in no time. Of course, the biggest people who suffer chronic diseases, especially on account of smoking and also too much drinking, are people within the ghettos. Of course, psychosocial support is one issue that comes around one too many times. How do we help the psychosocial well-being of these young people? What are the factors leading them to heavily smoking of cigarettes, to heavily drinking of alcohol? And do you actually initiate campaigns as Rocket Health to go into these communities, talk to these young people about the dangers of too much smoking, about the dangers of too much drinking, and so forth, and how they alleviate and how actually they lead into or culminate into chronic conditions or illnesses in that regard? Psychosocial support, is that a component you're looking at as Rocket Health?
All right, so at Rocket Health, we are able to provide, I'm glad to report that we're able to provide some form of psychosocial support. It's there's so many elements that play into psychosocial support. One could be this direct support from the physician or the doctor, right? The other one could be from psychiatry, psychiatry help and counseling, all right? Because when someone tells you you have HIV, you're not going to take it lightly. So you need some form of counseling. Good. All you have to do is talk to someone at Rocket Health in case you don't know you don't have anyone to confide in. But also, in addition, we provide extra services. For example, in the month of October, we did the men's health awareness campaign. Then the following month, we did a breast cancer awareness month. We do such campaigns to be able to promote and let people know about these chronic diseases and how they can manage them. And then we also even provide discounts for these people so that when they know, they can be able to test and get their treatment from us.
You know, it would be one thing to be in a pandemic and another not to talk about the same COVID-19 disease that is giving us sleepless nights. How has this pandemic compounded this problem when it comes to the exacerbation in the number of cases we are registering as far as chronic diseases are concerned? How did COVID-19 make this worse as far as these chronic illnesses are concerned?
So in the era of COVID-19, all right, one of the biggest problems is that you're unable to go to the hospital where you used to get your medication. So let's say you're a diabetes patient, and you know that people with chronic diseases like diabetes, high blood pressure, and so on stand a higher risk of dying from COVID-19. All right, so you are afraid because of diabetes, but then remember, you take medicine every month. So what are you going to do about it? And that's where Rocket Health still provides a solution, that you're still able to get your treatment, all right, from wherever you are, and not have to be exposed to chronic COVID-19. So we've seen a rise in the numbers of people who have used the services, especially because of COVID-19. And I think that's the reason. The main reason is because there is a need and a gap, and Rocket Health is able to address that gap. So by providing an easy alternative of getting medication, of having to talk to a doctor without you being exposed to or standing a higher risk of dying, I think Rocket Health, even for other people, would provide that kind of solution. So that's what we're trying to sell to people, or trying to advertise to people, that you really don't have to lose anything.
Indeed.
You just have to talk to one.
Indeed, Simon. And of course, Simon, COVID-19 caused a lot of havoc. You did have so many people who lost their jobs. Companies were shut down. Exactly. There was a lot of stress exerted, especially on the young people. Imagine a COVID-19 pandemic finding you when you are unemployed, and then it continues to ravage you very, very badly. Unemployment was rife among young people. It continued to actually go deeper amongst the young people as this COVID-19 pandemic actually ravaged us more and more. So the psychological distress of the young people. Exactly. They became more of drug users. There was too much of drug abuse taking center stage within the ghettos and so forth. Would you say that because of that stress is the reason as to why many of these young people resorted to heavy drug use in this COVID-19 pandemic? Yes,
that's very true. Because as you're dealing with stress, one of the instant stress relief is smoking, alcohol. You stop eating well, you overeat, and then as a result, you stand a higher risk of developing such chronic diseases. So when it comes to these young people, so chronic diseases don't come in over one night.
One swing, yes.
So it's something that you continuously do, and COVID-19 is one of those reasons why people deal with such things that we've talked about.
You're smoking cigarettes. COVID-19 is not allowing you to move, yet if you had been walking a little bit, you'd be exercising and you'd be alleviating all those challenges. So it was a whole mix. Let's talk about the caregivers, Simon. What role should the caregivers be playing in here to help us alleviate all these chronic illnesses that are challenging our people?
All right, so when we talk about caregivers, we're talking about parents for children with chronic disease. We're talking about let's say we're talking about wives to husbands with chronic disease, or generally the family members, right? So when you understand that one of your family members has a chronic disease, it requires some sort of special attention
and patience.
It's too much that they're dealing with that disease. So trying to help identify their problems, and also be on the lookout for any other. We've talked about they need psychosocial support. So you need to be able to understand if someone is, for example, depressed because of a chronic disease. You need to be able to understand that if someone needs some special kind of attention, that they need to wake up much earlier to be able to do something. They need to do extra activities, exercise, and all those things. You need to be able to provide an anchor to help them be able to fight.
Amazing.
Fight
Simon, what should the caretaker have in their mind or at the bottom of their mind when they're dealing with the elderly, people who are grappling with chronic illnesses? What should they have in mind?
All right, so they need to know, I think, I would say one of the most important things is when it comes to elderly is in terms of, I think, their medication. One of the things that we normally see is children to old people with diabetes or their other family members calling us to help remind them to take medication. So you need to be able, because oftentimes they're going to forget that they need medication.
Indeed.
Oftentimes they're going to give up because they feel like they are almost nearing their death.
Indeed.
Yeah, right?
So you need to be giving them hope.
You need to give them hope. You need to provide you need to go an extra mile to be able to make sure that they adhere to treatment and at the same time live a stress-free life, because stress will just compound and will just add on to the chronic disease and make sure and
indeed.
Yeah.
Give us an expert recommendation as to how we can alleviate chronic illnesses in a minute to our viewers.
Sorry,
recommendations from Rocket Health on how to alleviate chronic illnesses or avoid them.
All right, so one of the things that we need to do is, one, we do extra physical activities.
Indeed.
You need to avoid smoking.
All right.
Avoid excess alcohol consumption.
Indeed.
Talk to someone if you're feeling sad. Always test early in cases of cancer, because the earlier you know, the better your chances of surviving. And then in case you need medication, make sure you're plugged into a good support system, and Rocket Health offers that kind of system. So all you have to do is dial *280# and talk to one of our doctors to be able to take you through.
A very insightful conversation, I might say, that I've had with Simon Tumusime. He is a doctor with Rocket Health. Thank you very much for coming through. Many of our young people and also the elderly were actually clamoring to hear more of the information coming in as far as alleviation of this problem is concerned. You did most.
Thank you. Thank you for having me.
And indeed.
All
right. Kind regards to everyone at Rocket Health. You are still watching Morning at 10 TV. My name is Roman Busiko, and of course, this is the platform that is geared towards acquainting you with that information that you need to conquer your day, conquer your week, vis-a-vis conquer your careers. We do have a conversation that is largely going to focus on whether or not schools are ready for the sexual reproductive health and rights challenge as far as schools are concerned ahead of the reopening in January of 2022. Patricia is